you'll want to have your CPT book handy during this video. There'll be times when you'll want to pause the video and open your book and identify the concept that I'm showing and demonstrating. So definitely have your book handy so that you can do that. I'm getting the information from this video from your Bucks Chapter 8 and your Fordney Chapter 13. Both of those are like your intro to CPT code chapters. So if you want more information, definitely you can reference those two resources. So CPT, what is it? Okay. CPT stands for Current Procedural Terminology. Procedures have prices. These are the things that we do to a patient that the doctor wants to be paid for. This could just be an exam, it could be testing, it could be surgery, it could be all kinds of things, and they're all in this book. So who is in charge of it? Who maintains this book? Right there. AMA, American Medical Association. They are in charge of it. These codes are copyrighted by the American Medical Association. There are several different books published here. I'm holding a professional version. There's also a standard and an expert. I've used the expert. I don't find that there's anything special about it. I like the professional much better than the standard. First of all, the professional has the spiral rings. The standard does not. It's a normal bound textbook. And I find that the professional is a lot more colorful. There's more pictures. It's easier for me to read quickly. The other thing is that the professional, open up your first page, comes with a page of tabs. These are stickers that you can use to label different sections in your book. The labels make it easy for faster page flipping. So you need to decide for your book how many tabs are good for you. I don't like a lot of tabs. They kind of drive me a little bit crazy, sticking out the edge. It kind of just rubs on me a little crazy. But I've had plenty of students who like tab it up and use every tab they're given plus put in more. You can buy tabs at the office supply store, Walmart, or any office supply store, and they make their own because they want more than what the book came with them. And that's fine. You do you, I do me. So you do your book your way. There are updates. The book that I'm holding has in the corner 2019. Some of you may have 2020 books. You may be even watching this video into 2021. So they are updated every year. Why? Because codes change. There are new procedures that are created by doctors, different ways of doing surgeries. There's just lots of changes every year. Or they decide that a section, they want to just revamp it. They revamped part of the x-rays, in my opinion, for absolutely no reason a couple of years ago. I didn't see anything wrong with the old way of doing it, but somebody thought it needed some revamping. So what does a CPT code look like? A CPT code is 5 digits. Always. Even if the beginning may start with a 0, but there's always going to be 5 digits. There's also no punctuation. If you've already started ICD coding, you know that there's a decimal point as part of the ICD code. CPT does not have that. Always numbers, always 5, never a decimal point, never any punctuation. How is it organized? Well, all the codes, all the procedures that we can do to a patient fit into these 6 sections. Evaluation and management. Anesthesia, surgery, radiology, pathology and laboratory, or medicine. Anesthesia is literally the medication to keep the patient unconscious during a surgery. So those codes codes are only going to be used by an anesthesiologist who is keeping the patient unconscious. And then the surgeon who's billing for the gallbladder or the appendix is going to use a code for the surgery itself from the surgery section. It's very easy to get a little sidetracked on the word surgery. A lot of people think that means you're in a hospital and you're unconscious laying on a table while they cut you open. That's not the case. Surgery really is any alteration to your body. So if I go into the doctor's office and I've got a wart and we burn it off, that's surgery. Okay, doing a biopsy, like a little skin biopsy, putting 2 stitches into your hand because you cut yourself with a kitchen knife. Those are all surgery, and I'm fully awake. Radiology is any imaging of your body. We're not cutting you open. We are doing just a regular x-ray. We might be doing an MRI or a CAT scan or ultrasound. There's several other kinds like PET scans and fluoroscopies. There's a bunch more. But we're just imaging through the skin to see the internal structure. Pathology and laboratory. Those codes are where we're testing any tissue or fluid that we can take out of your body. We can draw blood. We can take urine. We can take hair. We can take a cheek swab. We can do a biopsy where we maybe put a needle in and we took a piece of your lung tissue or your kidney tissue and we pull it out and we do a biopsy on that. It can be a skin biopsy. We can do a cell rubbing of the cervix. That's what a pap smear is. And we can test those cells. We can swab your throat to test for strep. Okay? All of those are going to be codes in your laboratory and pathology section. And then medicine is everything else that doesn't fit into those other categories. Some of the biggest sections that I'm familiar with is physical medicine, all your physical medicine codes, chiropractic codes, vision, hearing. There's just a lot of things in that section. And I skipped evaluation and management because I knew I had a whole slide on that. Evaluation and management are known as the exam codes. You may call them an office visit. You may have an office visit copay on your insurance. These can be performed in many locations. You could be in the doctor's office, the emergency room, a nursing home, the neonatal area of the hospital. The doctor could go to a birthing center. The doctor could even do a house call and they could be at your house. Okay, so these office visits aren't always in the office. That's why we don't call them office visits officially. We call them evaluation and management. It means that we are evaluating the patient through talking to them and doing a physical exam, and then managing, which is what are we going to do about it? How are we going to help this patient improve what their complaints are? Coding is separated based on whether you're a new or established patient, and then it's coded based on the severity. So the more severe symptoms the patient has, the higher level they'll be and the more you get paid. So I'm going to jump back. If you notice, the anesthesia codes all begin with a 0. Surgery begin with 1 through 6. Radiology all begin with a 7. Path and lab all begin with an 8. And your evaluation in management and medicine are 9s. So how do we separate them? You are going to literally have to memorize this code set, 99201 to 99499. Then medicine is all the other 9s that are not part of that range. So if you're in your first module, I don't need you to memorize this now. You have more things to focus on right now. But if you're in your 4th mod, you're in your 5th mod, and your CBCS certification test is coming up, you need to have these memorized by now. All of this of what I just said as far as what the codes look like. What do they start with? Why? Because on your CBCS, you might get a question like this. Code 72082 is what kind of code? And it's multiple choice, and they tell you anesthesia, surgery, radiology, or pathology. Well, you know it starts with a 7, so you know your answer is radiology. The other way they can word it is, which of these is a surgery code? And give you 4 codes to choose from, one of which falls into the category of beginning with a 1 through a 6. So you need to be able to recognize them real quickly as to which category they fall into. As I said, if you're in your first mod, don't worry about it yet. You've got a lot of days ahead of you in school. You'll get there. There are symbols in your book. I took this screenshot from inside your front cover right up here. However, the symbols are also defined at the bottom of every page, so that when you see a symbol on a page and you're not sure what it means, it's literally right there in front of your face. You just have to look down. Now, you do need to know kind of what it means, because all it's going to say is add-on code, exemptions to modifier 51, new code. If you don't know what those mean, then that little help at the bottom of the page still doesn't help you. Okay. So I will be talking about the add-on code here in a minute. I would think a new code is kind of self-explanatory. It means that this code is new in the year's book you are holding. So a code that's new in 2019 is going to have that bullet in front of it. But come 2020, when it's not a new code anymore, the bullet goes away, and different codes will have the bullet. Revised means that it's changed from the previous year. The exemption to modifier 51 means that you cannot use a modifier 51 on that code. This video is going to include what are modifiers. So at this point, you may not understand what I mean by modifier 51, but you will by the time you get done with this video. Okay, some of the designs that you're going to see as to how the pages are going to be laid out, I want to talk about indentations and the semicolon. I want you to notice that this code is indented, and we have a semicolon right here. Right here. Okay, so that's what I'm talking about with this slide. So when you see a semicolon, it is separating the code definition into 2 parts. The first part is called the common definition. The part after the semicolon is called the unique definition. And I don't always talk about this, so you may not have heard this in a previous video if you've watched any of my other CPT videos. And what we mean by this is that the common definition is shared with the codes that are indented underneath. This part is not shared. That part that's unique stays at that code only. Okay? So code 11004 is debridement of the skin, subcutaneous tissue, muscle, or fascia for necrotizing soft tissue infection of the external genitalia and perineum. Well, what if the patient has this debridement not in those body parts? That's what the next 2 codes are for. Code 11005 starts with the common definition. Debridement of skin, subcutaneous tissue, muscle, and fascia for necrotizing soft tissue infection, abdominal wall with or without fascial closure. And code 11006, debridement of the skin, subcutaneous tissue, muscle, and fascia for necrotizing soft tissue infection, external genitalia, perineum, and abdominal wall with or without fascial closure. So when you look at code 11006 all by itself, all it has is some body parts. It doesn't tell you what the procedure is. So if that's where you end up and you think that that code is your correct code, make sure that you notice it's indented and that part of the definition is going to come from the one above. Now, sometimes you'll have that one, the whole definition with the common and unique, and then there's maybe 15 codes indented underneath. And you're looking at the very last of that list of 15. You have to look kind of a long way before you find the one that's not indented, but just keep at it. You'll find it. Colonoscopy is one that is like that has a ton indented underneath. And that's okay. You just got to look for it. And you got to know that you need to look for it by noticing that it's indented. Okay, I told you I'd talk about the plus sign, that add-on code. That's that symbol that you need to know what an add-on code means. So I'm giving you an example here on the page of how the add-on code works. I always use the example in the classroom. You have to have a house before you can add on to the house, right? You can't do an add-on or an addition to something you don't have. So you have to have a code before you can add on to that code. Okay, so an add-on code gets attached to another code. It can never be used by itself. So if you try to tell me that the code is a 11001, all by itself, that's the only answer, that's not right. It can't be right because it can never be alone. He's a little needy. This code is a little needy and can never be alone. He needs his BFF. How do we know what codes it can be added to? There's always a comment underneath it telling you what code it can be added to. Sometimes it can only be added onto one code. Sometimes it's 2 or 3. Sometimes it's a whole list. Oftentimes the code it can be added on is right above it, but that's not mandatory. Sometimes you're pages away. Sometimes it's a whole different section. It will tell you. Read it and make sure that you don't violate what it says. So if you tried to add a code 11001 to anything other than a 11000, you're wrong. Okay? Because it can't be. It tells you right there it's the only code it can be added to. So this code is also indented, and we have that semicolon right here. So code 11000, debridement of the extensive eczematous skin up to 10% of the body surface area. And then this code is for each additional 10%. So if we did 20% of the body surface area, we need both codes. And you would write it like that. 20% of the skin. Well, what if we did 30% of the skin? How do we code that? Well, we know that 11000 is the first 10%. And we know that 11001 is the next 10%. Now we're up to 20%. How do we get our next 10% to get it up to 30? We're going to do a times 2, which is showing us a quantity. So we're saying times 2 quantities of the additional 10%. Because you can only have one first 10%. You can't have more than one first. But you can have more additionals. And so you would code it like that. If you forgot the times 2, you're going to short your doctor some money. Your doctor's reimbursement will be less because you did not get the doctor paid for every bit of the service that was performed. Okay. The appendix. Well, let's talk about your book before we get to the appendix. You have an alphabetical listing here in the back. In my book, those pages are edged in purple. Your book might have a different color. Then we have the code section, which is towards the front of the book, which is really colorful. Every section is a different color. Great. But when you get to the end of the code, the end of the 9s, then you have some pages that are called Category 1 and 2 codes. I'm going to skip that for the moment. And then we have appendixes. And we have Appendix A through Appendix, I think, K-L. Oh, P. It goes to P. And I want you to familiarize yourself with what they are. You're not going to use them a ton, but when you need them, it's really handy to know that it even exists. So flip through them yourself and get to know them. Okay, your guidelines. You will see the guidelines throughout your codes, and the guidelines are the rules. These are telling you how to use the codes in that section and if there are any special rules that apply. Some of them are very short. Some of them are a little paragraph. Some of them are a whole page long. Some of them are 3 pages long. If you are coding from that section, you may need to read that section. So if I'm debriding wounds, I may need to read that when performing debridement of a single wound, report the depth of the deepest tissue. But for multiple wounds, we're going to sum or add together the wounds of the same depth, but do not combine sums of different depth. So it's telling me what I can add together and what I don't add together. That's kind of important to know if you're doing that section. Okay. Here it talks about wound debridements. It talks about sometimes using a modifier. It gives you an example, okay? So that may be really important in getting your code selection correct from that section. So in the real world, are you going to have to know what all of these guidelines say? No. You need to, number one, know the ones that you use all the time. So if I do wound debridement all the time, then I should know this. But if I never do wound debridement, I might have read it when I was in school, but then I promptly forgot it. But if I ever end up in this section again, and I'm like, oh, I don't remember this, guess what? The guidelines are right there for you to refresh, read it, and go, oh, I kind of remember this, and now you can make your correct code selection. Okay, so your index, which I mentioned was towards the back of the book, is where you start. You're going to look up your procedure that you are coding for your patient, and there's a couple different ways you can look it up. You can look it up by the name of the procedure. We did a removal, we did a repair, we did an injection. You can look it up by body part. If you've already started your ICD coding, then you know that you can never look up a body part in ICD, but you can in CPT. Different rules. Different person wrote the book. You can also look up the medical terminology word for the procedure. So if I tell you that the doctor removed the patient's appendix, we can look up the procedure, a removal. We can look up a body part, the appendix, or we can look up appendectomy, the medical term for removing the appendix. An eponym is a procedure named after a doctor, and it's the doctor who coined that procedure. For example, you do a Whipple. They do Whipples on Grey's Anatomy all the time. Okay, we're going to do a Whipple. It's a pancreas procedure. And guess what? You can look up a Whipple. I had a foot procedure done. It was called a chevron procedure. It's a bunion procedure, but it's called a chevron. And guess what? You can code it from that. You can also look up an abbreviation: MRI, CBC, CT scan, CAT scan. And you'll be able to find it. Some of them, you'll find it under the abbreviation. Like if you look up CT scan, you'll find it. But if you look up MRI, it's going to say, look up, and it'll tell you what MRI stands for, magnetic resonance imaging. And you don't need to know that. Guess what? You look up MRI, and it'll tell you. So you can look up the abbreviation as well, if that's an option for what you're trying to code. Okay. So I just gave you a quick picture here of a section from that alphabetical index. So you look it up, a couple of words here. It's guiding you to your potential codes. This is not the answer. This is a suggested answer. You have to confirm it. Sometimes it'll just give you one code. Sometimes it gives you two codes. Sometimes it refers you to look up something else. That's one of those abbreviation ones I was talking about. And sometimes it gives you a range of codes with a hyphen. You have to look up all the codes that it suggests. The ranges are not usually as long as they look. I've had one range that came up that said it looked like the range was about 40 codes long, and you're like, oh my God, I have to look at 40 codes? When you get there, you find out it's like 7. It's because they skip numbers. The codes don't go in order. They don't go 1, 2, 3, 4, 5. Because how would they ever add new ones in the future if there weren't gaps? So the ranges are never as long as they look. So that one that I circled, it goes 23415 to 23420, which looks like it's 6 codes long. It's probably 2. Okay. So now you may need to get some scrap paper and write it down. Because if you're like me, you'll remember like the first 3 numbers, and then you'll go, what were the last 2 again? I don't remember them very well. So jot it down if you need some scrap paper. And then go to the actual code section and look it up. When you go to the code pages, up in the top corner, it does have the codes that are on that page. Okay, so it's kind of like a phone book, for those of you who were around when phone books were still a thing. It has like the words that are going to be on that page. I say that because my kids are just out of high school, and like they never used a phone book, they never used an encyclopedia, like they never knew a time that Google wasn't, the way to look everything up. Okay. I already talked about quantities. This slide was here so I didn't forget to talk about it. So like this code, these say each. What if you do more than one? You add those quantities that I've already talked about. How are you going to know that you need quantities? Read your documentation and then compare it to the code you're trying to pick out. So notice these codes all say each. So what does your documentation say that your doctor did? 1, 2, 3. All right, CCI, also known as NCCI. It's called the National Correct Coding Initiative. Sometimes that N is dropped, but officially it's there, but a lot of times it's dropped. So CCI, Correct Coding Initiative. This is a federal policy. It analyzes every code in that CPT book and determines what can and cannot be billed together. There are some code combinations that do not work. Codes that are determined to be an integral component of another procedure cannot be billed separately. So if, for example, you take out my appendix, in order to get to my appendix, doctor has to cut me open, which means when they're done, they better sew me up, right? Well, putting stitches into my belly is not going to be billable because it's part of taking out my appendix. Okay? But different patient comes into the emergency room and has a cut on their belly that needs stitches, no appendix involved, we get to bill for putting in those stitches. Okay? So one patient we can bill it and one patient we can't. What's the difference? Well, one is it's part of another procedure and you cannot bill it. So if you try to bill those belly stitches on the same claim as removing an appendix, CCI Edit will find you and it will reject you. I'm going to do a whole bonus video on CCI because I just gave you the most basic definition of a CCI. There's a lot more to it. Okay, I'm going to do a bonus video on CCIs. You write that down because I know it's not on my list at the moment, so that you can get a little more in-depth. Global package and global periods. Global means paying for everything in one lump sum. Okay. Surgical procedures are paid by the package. That same example I was just using with the appendix. Okay. You had to cut me open, you had to sew me up. You had to document what you did. You had to write a chart note or a surgical note. There's some supplies. Okay, you used gloves, you used scalpels, you used some thread to stitch me up. Okay, there's surgical supplies that you used to do my surgery. Okay. When the doctor is paid for the surgery, they're paid for all of those things in one lump sum. So we don't get to bill all those things line by line. We're going to bill for the removal of the appendix, and it paid for everything. Okay? There's also something, that's the global package. There's also another term called the global period. The period is a time frame. Okay? And there's only 3 to choose from, 0, 10, or 90. It's not like there's a whole variety list of them. There's only 3, 0, 10, and 90. What this means is that when the doctor was paid for that appendix removal, follow-up care was also paid. Okay? So the doctor doesn't get to bill for your checkups after the surgery. How do you know how many days? There is a list that you can reference by CPT code, and it'll tell you how many days. These are zeros. These are 10s, these are 90s. So if my patient had this procedure, I don't even know what it is, but it doesn't matter, 90 days of follow-up care is included. So if the patient comes in and has a checkup post-surgery, and the doctor goes, how you doing? How's your pain? How's the healing? Are you doing okay? And the patient goes, I'm good. Yeah, it hurts, but it's probably normal, all those kinds of things. That's a free visit. What do you think happens if the patient comes in on day 91 and has that same kind of visit? You think it's free? You get to bill the insurance because they're coming in beyond the included time frame. So these procedures have no follow-up care. 0 days means if the patient comes back the next day and goes, Doc, this hurts. For example, if you do a scope and you put a scope down up my nose and down my throat to look at my larynx or my esophagus, that's a 0-day package. So I come in tomorrow and go, Doc, my throat's really scratchy since yesterday. Can you take another look at it? Guess what? They're going to bill you for another scope. Or maybe we're just going to look down the mouth without a scope, in which case it's an E&M. But we get to bill for that because a follow-up day is not included. Multiple procedures. Sometimes we do more than one procedure at a time. Let's say the patient has some skin cancer. And so we remove some skin cancer from the forehead, and we remove some skin cancer from the forearm. So I got a spot here, and I've got a spot here. And we're going to take them both off during the same visit. That's 2 procedures. That's a multiple procedure. We are going to bill the most expensive procedure first, and then the additional procedure is going to be amended a modifier 51. And that's telling the insurance that it is not the primary procedure. It's not number 1. And all of the additional procedures, you're going to get paid a little less on. Imagine you came in for a C-section. We're delivering a baby and we do a C-section. And while we're in there, the mama wants to have her tubes tied, a tubal ligation, because she's done having babies. So doctor delivers the baby. Before sewing you up, we tie some tubes. Those are 2 separate procedures. The C-section is the more expensive. The tubes tying is the cheaper. So we're not going to get paid as much on that tubal ligation, if the patient came in on a day just for a tubal ligation, we'd get paid more than if we did it in conjunction with a C-section. Well, at first glance, you might think that's not fair. They're doing the same thing. Oh, no, they're not. Got to remember, for the C-section, we're already cutting the patient open and sewing them up. If we do the tubal ligation alone, we're cutting them open and sewing them up. So if you do the procedures together, we're only cutting them open once, sewing them up once. So actually, doctor is doing less work when we do them together. That's why we don't get paid as much. Well, you might think, okay, well, to remove that skin cancer on my forehead and my arm is just as much work. They're two different body parts. That's not like the same example as the C-section you just gave me. Think about it. The doctor comes into the room to see you as a patient and does the small talk at the beginning. Guess what? That small talk's only being done one time versus 2 times. Wrapping it up and saying goodbye is only 1 time instead of 2 times. So you really are doing just a little bit extra to do that second spot of skin cancer. Okay? And I'm going to use the same scalpel that I've already got dirty. I'm going to use the same gloves that I've already got dirty. So I'm actually saving on supplies as well. So when you look at it as a whole, you really are doing less work when you do multiple procedures. Upcoating, downcoating, and bundling. All of these are bad. All of this is approaching the realm of fraud. Bad. Okay. Upcoating means that you build a procedure higher level than what you actually did. Downcoating is billing a procedure lower than what you actually did. Both of them are bad. You are to code correctly. You are to code what you did. Unbundling means taking a code apart. Let me explain that one. If we do a hysterectomy on a patient, there is a code that says hysterectomy including ovaries and fallopian tubes. So this is a bundled code. One code, we took out all those structures. Well, guess what? There's also a code for just hysterectomy, just ovary, and just the fallopian tubes, because sometimes you only do one of those body parts and leave the others behind. So if we were to bill this as 3 separate removals, what we did is we unbundled this bundled code, and we billed its component pieces instead of an all-inclusive code. Not okay. There is a bundled code for a reason. Okay, so now we're going to talk about modifiers. If you want to refer to your textbook, Bucks Chapter 9, 4D Chapter 13, both of those have a whole section on modifiers. A modifier is a 2-digit add-on to a CPT code. It can be numeric or alphanumeric. And when you have a code added, when you have a modifier, it's going to be written like this. It's going to have a hyphen and then that 2-digit modifier. The modifier defines the circumstances under how the procedure was performed. Or it might be just informational. Sometimes modifiers will change how much they pay you. It might go up, it might go down. And sometimes you might need more than one if your circumstances call for it. The more exposure you have to modifiers, the easier modifiers are. The trick is knowing that a modifier exists in the first place. It's hard to use a modifier that you don't even know exists. So you have to expose yourself to the list of modifiers so that when the situation calls for it, you recognize it and go, modifier, right there. It just jumps out at you once you know them. In your CPT book, open your front cover. Right here on the inside front cover is a list of modifiers, 2 columns. Okay? I have a portion of that list here on the screen. Once you're familiar with the modifiers, this cheat list, or quick reference list, it's not really cheating, it's there for a reason. This reference list is helpful because you know what this means. You know what this means. You know what this means. But when you're learning, you don't know what they mean. Appendix A has more information where it gives like a little paragraph rather than just the 2 words that are here on this screen. So in the beginning, you might need to be referencing that appendix so that you fully understand the use of that modifier. So I'm going to talk about some ones that are a little tricky, as well as some of the most common ones, especially the ones that you'll use here in the classroom. Modifiers 55, 54, 55, 56 takes a global surgical package and it blows it up into the 3 parts. So I had told you how they pay the doctor all in one for that surgery. Well, what if the same doctor doesn't do all the parts? Then we have to split it up. So I go to Disney World. I live in Michigan. I go to Disney World in Florida. Disneyland, Disney World, I don't know, whatever one's in Florida. And I, unfortunately, have an appendix attack while I'm in Florida. I go to the emergency room and they remove it. So that surgeon in Florida did the surgical care. Guess what? I'm not hanging around for 90 days follow-up care while the weather might be nice. I'm not staying in Florida for my follow-up care. So I come back home to Michigan and I see my own doctor for the follow-up care. So my doctor here in Michigan is going to bill the post-op care. And a lot of times with surgery, there is no pre-op care because you don't get pre-op care for an appendix. If it's ready to blow, you find out when it's ready to come out. You don't have pre-op care. So my doctor in Florida who did the surgery is going to add that modifier 54 saying, I only did the surgery. Don't pay me for the rest. And the doctor in Michigan is still going to bill the same code saying, just pay me for the post-op care because I didn't do the surgery. There are several surgeries or several modifiers that if you have more than one doctor involved in the surgery, like a surgical team, those modifiers will come into play. You can look them over and you can see the difference between them. Modifier 22 and modifier 52 is for increased and reduced services. These two are going to affect your reimbursement. It's going to get you paid either more or less depending on this. Well, this is going to be if you didn't necessarily do the whole procedure. I'm going to bill the reduced service. For example, I do coding for MRIs. We have patients who we start the MRI, we get some pictures, but then they're claustrophobic or they're in too much pain to lay there, and we have to stop the procedure. Well, I'm not going to not bill it because we did get some images, but we didn't get enough. We didn't get a full scan. So we're going to bill that MRI, but with the modifier 52 saying, pay me less. I didn't do the whole thing. Some modifiers have some letters. Again, it's on that quick reference on the inside front cover. You have modifiers for each finger and toe, modifiers for the eyelids, and modifiers for several of the arteries of the heart. In our classroom, left and right, LT, RT, a lot of your coding will be marked wrong if you don't put on the left and right modifier if it's a left and right procedure. So if I do something on my left eye, you better put the LT modifier on. Always capital letters, by the way. Bilateral is a 50. Well, what if you do the procedure to both eyes? 50. Modifier 50. You're going to say, I did this, both eyes. A modifier 25 is when you do an evaluation of the patient on the same day as a procedure. So if we do an exam and then we do a biopsy on something. Decision for surgery during today's visit is a modifier 57, and I already talked about the multiple procedures modifier 51. So those are the only ones I'm going to talk about today. You really need to look over that list of modifiers, both columns, and familiarize yourself with them. Look in your Appendix A if you want some more, or go to those chapters that I referenced for your textbook, your Bucks and your Fordney's book. I will tell you that your modifiers that start with the letters are going to be in the HCPC book, not in your CPT appendix. So if you're looking up those ones, you're not going to find them in that Appendix A, and I want you to know why. But all these that are numeric will be. You do have a HCPC book in your classroom that you can always use. Your teacher, will show you where it is if you've never used it before. Okay? So now you should be ready to start doing some coding, getting used to using those modifiers. Okay? Always, big one in the classroom is paying attention to that left and right in coding in classroom for both homework and in-class assignments. So definitely be looking for those lefts and rights big time.